In this episode, I sit down with Jesse Greer. Jesse's career is incredible. He became a Green Beret officer with a medical background, working with the highest performing individuals in the world, providing them medical expertise and advice. He then took that experience into the hospital system, where he realized that you cannot fix the problem from within the system itself. After that, he launched Preamble, where he's been building a preeminent preventative holistic healthcare center, working with individuals to truly transform their lives. We go into what does that look like, what does it take, and his thoughts around scaling this to as many people as possible. It's a fantastic conversation. I hope you enjoy. So let's get into it. Jesse, it's great to have you on, man. Thanks for coming.
Yeah, thanks for having me, Zach. Appreciate it, man.
No, I mean, the appreciation is all mine. You have one of the more incredible careers and backgrounds that I've had the chance to dive into and learn more about. So for people who are meeting you, can you share a bit about you, your background, where you're coming from, and then we can dive into all the stuff that you're working on?
Yeah, sure. Well, look, I'm a physician. I live out in Scottsdale, Arizona right now. We run a prevention performance medical clinic out in Scottsdale, Arizona called Preamble. But this all kind of started from a lot of work I did in the military. So I spent most of my career in the military. I went from college to medical school, to the military's medical school out in Bethesda, Maryland, trained at Walter Reed, and then spent my next 7 years working for the Army, kind of underneath the Special Operations Command. Got some cool opportunities there. Did some cool stuff. I mean, happy to kind of talk about that weird kind of stroke of luck, and got a chance to try out for the Special Forces. Made it so kind of this doctor going through the whole Green Beret course and came out the other end, and then spent the last 4 years of my time in the military as a battalion surgeon within the Special Forces. So super fun job. A lot of applicable stuff that I've kind of led me to the path that I'm on now. And yeah, we can dive into that here as we get going.
Yeah, I'm laughing to myself because you said stroke of luck that gave you the opportunity to join the Special Forces. And I would think a lot of people hearing with the outside view is the amount of effort and blood, sweat, and tears you have to put in. So I love that you call it a stroke of luck. But what was the stroke of luck that kind of got you the opportunity?
Like there is no pathway. Not that many people would want to do it, I suppose, but as a physician in the Army, I mean, your job's to kind of work at a hospital or work for these units. There's no pathway for you to just go, hey, I want to try out for the Special Forces. There was a doctor who was in charge of all the doctors within Special Forces, who used to be a Green Beret. He was a medic, and he thought it would be really cool if there was an opportunity for doctors to get a little bit more familiar with the clientele that they serve. And so they opened up this one slot per year for a doctor to go through it. And I got caught off guard when he asked me if I'd do it. And I mean, I always wanted to, so first the answer was yes. And he told me I was number 4 on the list. And so they only let one in, per year and a half. And I was number 4. And the other 3, I think one of them broke their legs. 2 of them failed out of the selection process. And I just got the call like 4 months later that like they'd all kind of didn't make it through. And so I was up. And so there was those two things that kind of combined to make the luck. And then more luck actually kind of managing to pass through the course with the limited amount of experience that I had kind of doing it. So, it was a lot of luck involved. But yeah, definitely hard work for sure.
Yeah. I mean, what's the quote? Luck is where preparation meets opportunity. And then I was at a conference this weekend and someone gave me an asterisk to opportunity that I like, where it's a lot of life is maximizing the surface area of luck, which is putting oneself in the right place at the right time for luck to happen. I was like, yeah, so there is the hard work that comes along with it, but to everything you're doing, putting yourself in the right place. I'm sure you were talking about wanting to maybe explore this area. And so when someone knew that they needed to bring someone on, you were there and you were top of mind.
Yeah, it didn't come out of nowhere. I mean, you do manifest that. I'd be lying if I said it kind of wasn't in the overall scheme of things. I don't know. Yeah, you throw stuff like that out to the universe, and you have to do that first before it ever kind of comes your way. That's for sure.
Totally. Now then, so from your experience at Walter Reed and then to working with the Special Forces, what did that experience of elite military medicine and working with people that need to be at peak human performance, how did that influence your perspective on the average hospital system when you came back to Phoenix and started working at a Phoenix hospital?
Yeah. Well, yeah, I mean, working with peak performers, it's a fun job. People select into that. They're highly motivated, so you're there to kind of give tips, best practices. But I mean, for the most part, like stay out of the way, don't ruin something, and the cool things that you can learn that are applicable in getting good people even better. There's a lot of that science that applies to the average person and just how to think about the ways to improve their life. And it's these high performers that when you put them in high demand, repetitive deployments where their body gets stressed and they suffer a lot of ails from being blown up and at war for 15 years, it starts to take its toll, right? And being able to get them speaking that language again, and by that I mean into the habit of eating right, of working out. I just found that was way better than a lot of these crazy experiments and experimental treatments that we're sending them all over the U.S. to get. Correcting their hormones and reversing their metabolic issues, and just seeing the lights turn back on and realizing that, all those other modalities of treatments, they've got, some of them have utility. They're short-lived and they're not as effective as they could be if all the core aspects of everything aren't dialed in. And that's what really made the difference. And so, yeah, just seeing that. And then, I mean, I think it's pretty obvious to see switching over to the civilian side of things, completely none of that. The patient population is much different, and there is a hungry group of people out there who aren't sick, who realize the system's broken, want to be doing something about it. And then there's just nothing set up for them to do,
It's that area of, it's the area of the life cycle, or the part of the life cycle we're in, of this wellness industry, where we, from my perspective today, are still in the early adopters. The people that are willing to spend money out of pocket are those that usually require less education, probably don't need the services as much, and is more so doing it because it makes them feel better about their health. But for the people, to your point, that need the services, like, we're still far beyond, like, how is the infrastructure set up so that those who want to go make a radical change and help improve people's lives, probably still a few years out of developing and actually going and making the right, like, systemic impact. And you kind of described this as I was researching in preparative. The hospital system right now is rearranging deck chairs in the Titanic, right? That the system as it is and everything it is today has failed patients decades before chronic disease appears. And was there a moment in your career where you kind of realized this, that jumpstarted everything else? Did it build up over time? When did you come to this realization of you can't fix the system, you can't fix a broken system from within it?
Yeah, I mean, two weeks into working at my first civilian job, I think, just hit by this kind of severe, depression or, overwhelming sense of like, what the hell is going on? I was pretty stoked about the pay increase I was going to get, and then you're just like, well, no, that's definitely not worth it. And then go, like, I don't know, like most guys, I feel emotions, but maybe not sure or spend too much time thinking about where they came from, and then just kind of the more I dove into that, understanding that I've seen stuff that works. And when your hands aren't tied from all these rules of the way people are going to get reimbursed, or, the things that you can and can't do, if nobody's telling you that and you've got resources at hand, you just kind of make it happen. And it just wasn't set up like that. So yeah, I'd seen right, and then I saw wrong, and then it was like, well, how do we just kind of do what we were doing there, but for the average person? And people like Peter Attia were already out, and like the world was heading this way. It definitely was by no means just something I kind of came up with on my own. I'm still in the same current of the world that everybody else is, but it was obvious to make a change and set up something on our own.
There was a really interesting thing you just said there, where the right thing that you need to do, what's going to drive the impact, and the powers that be is just not going to let that happen. But like generalizably, who are the biggest proponents of that wrong? Like, where did you get the most pushback when you were in the existing system? Like, I know what I need to do. This is it.
Yeah.
But I just like, what got in your way at that point?
Yeah. I mean, it's a good point, because we always say who, or the ominous they, but there is never one person, right? It's always the structure that's set up to do this. And, coming from like those systems have to make money. They make money on disease codes and processes and reimbursements. And that stuff was set in motion a long time ago. And so, the people that you would want to send them to, whether they're nutritionists or physical therapists, they're there to, hit a disease code. There's something has to be present. They're going to get 2 weeks to work with them. They're not going to really push the boundaries on anything or really start working towards a root cause. So there's just nothing at all set up in place to do it. It's just there to put out fires and on to the next person. So you can kind of keep that billing cycle going. Everyone's just kind of a victim of the system that just grows to eat money and do what it does. And so I don't think there's anybody necessarily at fault. It's just, it makes money. It works. It's got to control itself.
Yeah. What is the quote? Like, show me the incentives and I'll show you their behavior, or I'll tell you their behavior. It's like it or not. So the faculty sponsor that I've been working with for the conference that I'm putting on, we've been discussing a lot about the Maha movement, because in my opinion, it's taken things too far, where it said like doctors are out to get you, or the medical system is out to get you. And that is one step removed from the incentive structure is just really wrong. Like, the way that you're going to make money is the way that you're going to bill for a service. And that is laughable to think we can have an expectation that people can just break the system they're working in from within the system.
Yeah. Yeah, no way. I mean, yeah, you're right. The doctors do get a bad rap, and it would actually maybe be refreshing if there was some villain or a person who's just like, no, I'm just here to get my, $200,000 bonus from all the vaccines I'm going to give you. You'd be like, great, we can just like villainize that guy and yell at him. I think they don't exist, Yeah.
So another thing I wanted to ask you, Jesse, on that is something you've stated is the importance of patients continuing to like think critically rather than blindly deferring to the experts. And that's something that we've kind of seen, where people will just go to the doctor, trust in them, and then leave and not actually use the information or come prepared with the information. And how has that been a problem, or how is that contributing to this problem within the medical space, where the incentive structure is wrong? People just come in to be told like when they're already sick versus not doing the work themselves. And how is that shifting as you're starting to see the landscape move?
Yeah, you're right. And that's another example of maybe where things can go too far. But I mean, when I was in my training, medical school and residency, yeah, you had to study a lot and you wanted to learn a lot, but you also had to be a good little monkey and repeat all the things that you were supposed to repeat and not really think too critically. And it does become kind of a default mode, especially if you've got 4 minutes to see a patient. And so hey, your A1C level is at here. So I'm supposed to start metformin. I'm supposed to do this. Your cholesterol is here. We need to start you on this. There's no real big kind of root cause analysis, right? Which is that thing that I'm really trying to get at when I tell people to maybe not blindly trust them, but to dig in there, is because there's more to be done. Just like your financial advisor, you would trust them to do this, but if they mess up or they weren't paying attention, you're the one that goes broke at the end of the day. Most medicine is probably akin to, like, in the financial world, to bankruptcy or reversal of credit card debt. It's not necessarily, hey, let's get your body earning some money, as it were, while it's resting. Let's make sure that metabolic health is great, that your body prefers to oxidize fat while you're at rest and doing low intensity exercise, that you understand that you owe a debt to the universe, and you owe more money the longer you live to prevent the entropy that is bound to occur, right? You owe that debt until you die, and there's nothing you can do about it. So let's figure out these ways that are reproducible, low impact and low stress, that you can continue to do, that drives this health. And I mean, there is a huge shift in the way people are starting to think about it. And yeah, that's usually when they tend to find us.
Yeah. And we were just discussing this in a class around which hard do you want to choose in life? Because they're both hard, like taking the daily discipline to either move the body, to eat healthy, to do the work, stay principled in how you manage. I'll speak for me and how I manage my health, my career. That is one level of hard. And the other level of hard is dealing with really complicated health issues, or getting to a point where it's going to take months and years to get back to a steady baseline. And it's just the question of which one do you want to go with? You mentioned something on, like people and how they are coming forward and working with the doctor, and we're kind of moving towards that space. Did you see that in the healthcare system, or has that really only been since you went and started up Preamble? Like, were people coming to the doctor's office with their data, or it's just a different demographic?
Yeah. I mean, look, my perspective on this, the time that I spent working in the medical system, in the civilian medical system anyways, was usually in the hospital in setting. So maybe a little bit of a skewed picture. Everybody's kind of sick coming in there. I think the majority of clinics probably are similar. And all that to say is that I know that I've had patients come in here who have taken data to their doctors, who have wanted to kind of push the boundaries a little bit in exploring their health, and then they just get completely shut down or
Mm,
dismissed. And so that's also why they end up finding us. So yeah, I don't think it's too common. There are patients that are doing it, but there's like, that's why clinics like mine can exist, because it's just not the way things work.
yeah. It's also just more fun when you get to work with people who are excited about taking the data and being a collaborator in the relationship of their own health, you know?
Yeah. No, that's right. I mean, like I'm not here to save anybody, like it's that, like, sometimes every once in a while somebody will sit down like, all right, how you gonna fix me, how you gonna do this, and it's just like, nope, wait, we're starting off on the wrong foot here. Like, I'm here to, yeah, like to help educate, to discuss these things with you, to introduce you to the right people, to lay out what a plan looks like. But this is gonna fall on you. Like, you're gonna feel responsible for this, and then if we're done, if I did my job correctly, I'm gonna build agency in you to where you can kind of go on, without me, and you're going to be fine. And now you've got a plan for this, right? If I have a chronic patient who's, on our top tier and I'm spending all this time with for 3 or 4 years, I haven't done a very good job.
Right. It's you're solving one of the hardest things to solve in this space, which is encouraging agency or building agency. And I think a prerequisite to agency is working with them to change their behavior. What does that look like? Yes, maybe you're having a little bit more of a motivated crowd come to Preamble, but how are you getting them on a daily basis or weekly basis to say, okay, I'm going to actually change how I show up for myself?
Yeah. I mean, you have to find the most motivating factor in somebody's condition, right? The biggest motivation will always win there. It's easy to try to bite off more than everybody can chew and build out a perfect plan that's just going to kind of fall on its face when you can't keep it up for a couple of weeks. I mean, look, usually it's movement, and usually it's starting to readdress the misconceptions people have about the way that they should be moving or working out. We put working out in this separate bucket from everything else that we do in life. And that's kind of where it starts, So we're either sitting down or behind a desk for the whole day, and then we go and we bust our ass at the gym and do some HIIT workout. And what combination of that is the correct one? And we just starting to switch that, starting to get people thinking about cardio in a different way. Peter Attia calls it zone 2. And I find that it's a great concept. It gets lost on a lot of people. I think when you start, like over, analyzing it or putting it into academic terms like that. But what we're talking about is vigorous walking, for, hours per week, or the equivalency of, and how do we kind of instill that into people's that they don't need to be out there running 5 miles a day. They're probably running too hard. They're probably building up too much lactate. They're not improving their body's ability to oxidize fat and building up their aerobic base. They're not even working out their high-end anaerobic capacity. They're in these junk zones most of the time.
Mhm.
And if you get people to buy into it, get them to trust the process for a bit, give them some data, maybe from an exercise test that lets them know where these things are specifically for them, not necessarily just where their whoop is. Get them to consistently give you, 4 hours a week of that. Bring them back in for body composition rechecks to like give them stack some wins in there in between. Usually by, about 4 months, I can get folks to really, like, they just start to take it on their own. They see it. Oh, I feel better. I can breathe better. I've got more energy. My body fat percentage is down. And this is way easier than it was before. And then, okay, we still got some low hanging fruit on the nutrition aspect, on the sleep side of things. Let's start talking about your risk. Let's dig in there, and then, so yeah, but most motivating factor, and then take it from there.
Most motivating factor. Yeah, and I love how you start with the movement and the physical aspect. I mean, it makes sense to me. That's where you can see the most immediate wins. I think with all of
Mhm.
this health aspects is just being able to move the body, being able to feel the dopamine rewards that come from consistently showing up in that sense, and then giving them the landmarkers and stacking the wins early on. As I was doing research in consumer behavior methodology change, one of the things that kept coming up is humans like short-term gratification. And it's really hard to get people to take the long-term view and narrow it down into like, well, why am I going to do this? And if you can say, look, don't give me the next 20 years of your life, give me 4 months, or give me like 2 weeks or a
Mhm.
month, and break it into bite-sized chunks where someone can say, okay, I can do that. Like, that's more doable than completely changing my life. And another thing that I was thinking about as you were talking is the great Mike Tyson quote of like, everyone has a plan until they get punched in the face. And
Mhm.
it's like, that's where you have the flexibility. It's not the regimented schedule of this is exactly where you're going to do it every second of the day, but it's no, let's go do some vigorous walking. Let's start with that.
Yeah.
And I laughed at myself when I first started running because I was like, oh, my zone 2 is probably like an 8-minute mile or a 9-minute mile. And I did a 9-minute mile. I was in my zone 4. I was like, oh, okay. I need
Yeah.
to
Yeah.
like recalibrate what this actually means for me.
There are not very many people in the world who have an 8-minute mile at zone 2. There
But I
are,
just didn't
and
have
they're
the
called like
data.
professional marathoners, or they're really fast people. Yeah.
Yeah, I realized my zone 2 is a nice brisk walk with a backpack on. I was like, okay, good.
Yeah.
That's where I get it.
Yep. Yeah, you're right. And then there's the like, wait a minute, I'm not getting a runner's high. This is kind of boring. Am I doing something right? And so I often find it's more difficult to bring these high achievers down to where they need to be, as opposed to even just getting people up and moving off the couch. There's a quote somebody said, it was basically, 90% of people don't move enough, and then the other 10% are moving too hard. Right. And so
Uh,
it's like there's that sweet spot in the horseshoe where you're not moving too hard. Like where's that sweet spot? Yeah.
yeah. And so with that on the landmarkers and stacking wins and working with people, like right now your program with Preamble, you combine a bunch of stuff, right? You do the labs with people, you do the VO2 testing, you do metabolic testing, CGMs, wearables. There's so much out there. If someone is working with you and your team and they open up a dashboard or they go to look at the core metrics that are important to them, what are the top ones where you're actually making decisions week to week with this person or month to month? You're saying this is what we really want to look at, is you're making the right steps in the right direction.
Yeah. I think there's the body composition markers. I don't know what it is about the universe. If we decide to change the way we eat, adjust the calories, start adding some pieces of an exercise regimen in there, you're gonna probably gain weight. Like, it just gains like 2 or 3 pounds right off the bat as the body changes. So, and it's there. I think it's just the devil there to discourage us. Just something there. Nope, you're on the wrong path. Because that's one of those things you got to fight against every time. The in-body scans are something that gives you a little bit more accuracy on the body composition, at least when there is a couple pound gain. And if somebody's moving more, it typically won't put on as fat if we're doing it right. So understanding that, what the scale says, but what's really going on underneath there is helpful. Okay, yeah, I put on a pound or two, but it's like muscle as I'm starting to do this. That's great. We like to track the reductions in visceral fat. Sometimes you need to wait a little bit longer, sometimes months, to see improvement in insulin sensitivity from that standpoint. I'd say those are the big ones. Look, I think the things that we're changing day to day would be more of somebody's sleep, somebody's recovery in the morning, can give us a good sign into whether or not they're overtraining. Maybe we need to slow things down a bit. Maybe we got some room to start adding on some high intensity stuff as well. It's going to vary kind of depending on what people are, what their main goals are. Everyone's kind of got their own crosses and issues.
I Okay, you just sparked a question that I'd be so curious to gauge your thoughts on, because I've always been curious about it. Because you mentioned, recovery versus then introducing high intensity interval training. So, the whole obsession over metrics is one of the things to also be careful about, because you wake up
Totally.
and you feel good and then you look at your Whoop and it says, oh, you didn't get good sleep. And now, okay, wow, I should feel bad. Similar on the other side, like waking up feeling good, but recovery says, hey, you probably didn't sleep well, you didn't get recovery. What is the relationship with that? Like, how do you work with your patients? Because should I not be doing a HIIT training workout if I have like a Barry's class schedule, then I got a 43% on my recovery? How do you balance what the
Yeah.
data says and what the person is feeling, or what the person, quote unquote, should do on the plan?
Yeah. Now you're talking about, the first thing that pops in my mind is the reliability of that data that you're using to kind of make
Yeah.
decisions. And and I try to keep in mind this data is here as road signs, as guides, as something to kind of get us looking in the right direction. And I think kind of mastery level, you can probably do most of this stuff without that wearable data. It's more of a intrinsic feeling on how that is. And so I'm never quick to say disregard if you feel great waking up and doing that. Hopefully they correlate. Sometimes a Whoop or a wearable can just get a whole crap load of bad information while it was off a bit on your wrist or your finger throughout the night. It's going to batch that in there and give you some crap reading in the morning. So that can definitely be off. But it's the same thing with like zone 2. I notice we'll give people heart rate ranges and then they'll get super locked into those.
Mm,
And that will vary from day to day, depending on how well recovered you are. If you're sick, just if you're not feeling it. And so you don't want to be too locked into those either. So yeah, it's more of trying to use common sense. But for the most part, within this realm, you'll be pretty safe.
yeah. Yeah. Sticking within the safe, not the safe parameters, but the parameters of comfort where you're able to like push yourself to the right amounts. But also, it all goes down to the idea of do the basics that work for the individual, stay consistent in it, and don't over index on what a piece of tech that is still improving its accuracy is going to
Yeah.
actually tell you to
Yeah,
do.
for sure. Look, I mean, if I was in the tech business where I was trying to prove that my wearable was necessary for everybody to actually do anything, maybe that's not the best answer, but I think it's like most things. They're there to guide us and be helpful. And when they stop being helpful, then, time to move on to something else.
On that one, with the clients you work with, how do you balance the concierge serviceness? Like, are you engaging with people daily? Are you asking that they engage with a software daily? How does it actually work in terms of, okay, we're going to institute these changes. We're going to work with you and partner with you for Preamble. Like, how do you actually set you and your team up for success with the people you work with?
Yeah. Um, so like in our practice here, we don't do primary care. Like by primary care, I mean acute care, really. So, make sure everybody has a primary care doc when they work with us, meaning they got somebody to call if they've got a urinary tract infection or they got a sore throat and these types of things. Now we do primary care as far as like primary disease, like risk management and avoidance for sure. And we'll dive deep into that. But the way that we set things up, people come in, they get their big initial physical, we go through their action plan, and it spans exercise, nutrition, supplements, medications, additional testing that we're going to do. There's kind of these natural cadence that falls within there. When somebody's first starting it, we like to increase the level of that cadence check-ins kind of around like at least in that first like month 4 to 6 weeks to see how the programs are being implemented, to see how any questions or changes that need to be made. Before that, we're probably setting them up with some type of ancillary staff, whether they're trainers or physical therapists. They're usually always seeing our nutritionist, and so you're getting things in place there. There's probably a more frequent cadence at the beginning. If we're starting hormones or if we're doing something that's going to mess with somebody's labs for something that we're checking, that we're checking labs a little bit more frequently up front. But then we will tend to almost always do a full repeat of all those basic testings, VO2 max, DEXA, CGM, blood work, and things like that around that 4-month period, because you need that consistency for 4 months to really see that kind of notable change where it's just not some variation in the test that you could do one day and the next. You actually go, oh crap, yeah, this is great.
Yeah, we're seeing real significant change in the patient's life. And to your point around the distinction between PCP and the work you're doing at Preamble, where it splits, one of the thoughts that I've had in conversations I've had is what is wellness versus the medical space. And a distinction is what is all the work we're going to do to prevent you from being a patient? And then the medical system really helps in, okay, well, if you're a patient, like how do we take care of you? And that's kind of where, if you get sick, like if you have an issue, if you need to do something, go see an expert. Like that is, do that. If you want to work on never getting sick, not never, but on prolonging your health, let's work on that.
Hey, the American medical system is really good if you have an issue, car crash or heart attack or these specialties for sure. They're great. And you need a conduit into the money, the healthcare tax that you pay as health insurance, right? So we'll diagnose somebody with sleep apnea. Well, what's really cool is when you can get, $3,000 sleep apnea machine and all your sleep apnea supplies mailed to you when they're ready. Like we don't do that. Like it's going to be hard, so you should be getting that stuff paid for through your tax, and sometimes things are going to qualify for that. So, you need that conduit in. And so, that's where we exist on there. I think we really kind of round out somebody's healthcare portfolio, if you will.
Yeah, 100%. And with the people that you work with at Preamble and just in your life as well, from your experience at the military and then throughout your career, in one of your interviews, you emphasize strength, stability, and avoiding frailty, where no one who wants to be like the grandparent that can't hold a baby. And so as you put the bigger purpose that we talked about in people's perspective, what's the role of like relationships and community in this real world health span? And does that tie into the work that you're doing with Preamble, or you just more so are encouraging that this is a core tenet in our lives to go focus on?
Yeah, I mean, you're speaking of that kind of the core tenet of emotional health, mental health, good relationships, all
Yeah.
that. I think it's almost a prerequisite that's needed for wanting to do something like this for the right purposes. Sometimes people come in here and it's just their next obsession or just something else that they're going to perseverate on and drive themselves crazy. And I try to weed those out up front because I mean that's not necessarily the right way to do it. And there's so many avenues that you can go down with that mental health side of things. And so yeah, we mess around a bit with people understanding where maybe if they're high functioning but have a lot of underlying kind of just generalized non-specific anxiety that's really pulling from their quality of life, how to start thinking about that. I love those conversations, but I guess I'm not here as a psychiatrist or a psychologist,
Sure.
even though I do like to kind of dig into that space. It's just it gets so I don't know, it can get so deep and so variable for so many people, so we try to speak to those principles in the way that we deliver all of our messages and talk about things. But yes, for sure, I think those are things that are more side effects from somebody living a good life that should be present and kind of check the box like, okay, this there's not a whole bunch of other stuff going on that probably needs to be addressed first.
Mm-hmm.
Yeah.
Yeah, that makes a ton of sense. Is it as it being important, but it also being something that they will go and find and they will curate and create in their own life alongside all of the health changes that you are working directly with them to institute. And one of the things that I think is beautiful is so many times our physical health and our overall holistic health are inhibitions from our ability to go form relationships. And so in getting healthier and having more energy to go socialize and having more energy and physical fitness to go do activities like that opens up the world to then go and build relationship, build community and do it. And so they go very beautifully hand in hand. Like High Rocks, my friends and I were talking about, is a great example of you get to be fit and build friends. And like that's so amazing. I know we're coming up on time. I'll ask one more and then we can kind of bring it to a close. But it's something I've been thinking about is on a company like Preamble, you guys are driving real healthcare outcomes. And you're doing it because you are so high touch with the individual. And there's occasionally a trade-off between high touch and scale. So as you think about Preamble and where you're going, what's the vision that you have? Are you hoping to scale this? You're hoping to just do really good work or maybe something completely different?
Yeah, no, that's a great question. I think about it quite a bit because we do have ambitions to bring this to a lot more people in a lot of different places. But there is, and you think about the advancement of technology, the ability to take all this data, get more data, even simplify it, put it in front of you, kind of maybe even participate or do 99% of the diagnostics that you're going to need. At least it's heading in that direction. And then so where does the human come into place and why is a human even kind of needed? And it's on those personal relationships. It's understanding what this person's motivational factors are, knowing that you have this person to connect them to be there as a level of accountability and fine tune things as you move. And so how do you scale something like that? Well, I knew you can't start from the scalable version that doesn't have the magic, And so I know that when we run things and get people in here, we do have that. Where can that be bottled and then kind of put forward that's that's way more robust and useful than just a full body MRI company or an at-home blood testing company, because there's a lot of connective tissue missing in there. And so, the ways that we can kind of marry that and still provide help, but from a more remote capacity to drive this is kind of what we've been looking at and working with and doing some work with businesses and having some good results there, whether it's through personal, but also remote coaching. There are things that we've been looking into and having some pretty good success with.
That's awesome. Well, I wish you and Preamble all the success. I mean,
I
like
appreciate
I
that.
said, you're doing work that is driving health outcomes. I'm fascinated with how to even keep scaling and keep doing it, because with a physical store, it's very expensive, but the stuff that you said where you can digitize, you can put that in front of more people and just begin to institute awareness and change, then that's where the broad impact can come from.
Yeah, it's a process. It's a process. We get a lot of the function health people or the Prenuvo people that they know they want to do something. They start, they do it, and they go, oh, crap, now I got way more questions than I had before. Like that's our bread and butter.
Yeah. Well, you are not someone in my mind that I would be worried about shying away from a challenge based on what you've done in your past. So, Jesse,
Thanks, man.
thank you for all of this. One thing I like to ask all my guests is what's an intention you want to bring forward in this? Like we talked about manifestation and putting it out to the universe. In the next few weeks, next few days, whatever it is, like what's something you want to, like really put your energy towards?
Let's see. I guess I'd like to we are really putting our energy towards quality products that can be delivered to now groups of 50 people from a more remote standpoint and get similar outcomes. And so, we've kind of launched a smaller tier, less expensive. I mean, not expensive really at all, but a more affordable program where people can who maybe just would typically go with a one-off service can do it, speak with a human, and then kind of add on the services that they need in just a better fashion from there, and hopefully kind of be able to turn that into something bigger. Yeah,
That's awesome. Well, I'm excited to learn more about that and to champion and cheer you guys on the sides as you bring that to more people. But again, Jesse, thanks for coming on the podcast, man.
yeah.
It's
Thanks for
great to
having me.
learn from you and share what you're doing with as many people as I can.
Of course, man. I appreciate you having me. Look forward to talking again.
Yeah. First of
Yeah,
many.
yeah. Awesome, man. All right, have a good one.